Hello, my name is Detrina Gibson, and today I will be talking about how to prevent chronic diseases such as bipolar disorder and severe depression amongst children. So there are many different types of disorders or mental disorders amongst children here in the U.S. or all over the world, which are phobias, post-traumatic stress disorder. You also have the panic attacks, and the two that I'm discussing today, which are severe depression and bipolar disorder. So there are 1.9 million children who have been diagnosed here in the U.S. with severe depression, with 78% of them being treated as of 2018. Also, for bipolar disorder, there's 4.5 million children who have been diagnosed with bipolar disorder, as well as 53% are being treated as of 2018 as well. And the 4.5 million, since bipolar disorder is associated under the umbrella of behavioral disorders, that also includes children who may suffer from ADHD. So here is a chart where it shows the age range in which children have been diagnosed with depression, anxiety, or bipolar disorder, but we're only going to focus on the two today for our topic. So for depression, we notice that 12 through 17, that age range, are highly diagnosed with depression. And it could be due to the intensities of school, the environment at school, maybe just the physical capabilities of just coming into adulthood. So there are many different aspects of that. Also, for bipolar disorder, as we mentioned, it is under the umbrella of behavioral disorders. 6 to 11-year-olds are at the height of being diagnosed. And as we know, children, as they grow, they have the tendency to become rebellious, and that's just how life is. But it may have something to do with that heightened rate there of diagnosed children with bipolar disorder. But we still see that all age ranges are affected in some way. So here we're going to talk about what severe depression looks like. It is the feeling of sadness, fatigue, suicidal thoughts, also the feeling of guilt, which are lingering feelings. They're long-lasting, so it can, exist over the course of days, weeks, or months, even years. Also, some of the risk factors are just, tragedy that they may experience, whether it's child abuse, losing a loved one, a car accident. Also, physical and cognitive inabilities. So if they're feeling incompetent about their physical fitness or their learning abilities at their school, that can also cause them to fall into this hole of depression. So some examples for bipolar disorder, or some symptoms of bipolar disorder. For one, we do have the maniac symptoms, is what they're referred to, which are a combination of mood swings and depression, severe depression symptoms, because we do have children who have been diagnosed with both, as they are somewhat of a have a symbiotic relationship. So they use maniac symptoms to cover that degree. But mostly it's mood swings. So looking at this picture here, there's no middle ground. So you're either on the good side of the spectrum, where you're feeling okay and you're feeling at your best, or you're at the other side of the spectrum where you just kind of have that of a feeling and you don't want to be here and you're sad all of a sudden. Some of the risk factors: stress, the feeling of failure, which can occur in many different instances, such as sports or even just maybe academically. Also, drugs and alcohol. And you'll see that a lot in the older ranges. So many teenagers experience bipolar disorder from alcohol and drugs. So the 6 dimensions of wellness: there's occupational, spiritual, emotional, social, physical, and also intellectual. So occupational wellness, not too heavy here, although there are some children that are in their teens that do have summer jobs or may even, work alongside their parents. So they may have a little bit of stress, but not the stress to take care of a family. So I don't see that being too much of a struggle. As far as intellectual wellness, being feeling cognitively progressive in the classroom or at home. If they don't feel those things, then that can be sort of detrimental for that particular dimension. For social wellness, if you're feeling depressed, or for children with bipolar disorders are feeling like they're just on the end of the slope of the spectrum, they may not want to come out and contribute to their community or to their support system. They may want to be isolated and fall away from that. And that can go back and forth. So sometimes that social wellness may be heightened, and sometimes it may not. But spiritual wellness, which is feeling like you have a purpose here on this land, and emotional wellness, understanding and accepting the feelings that you are expressing or you're thinking about. Those two are very important when it comes to children and these disorders. But we also have physical wellness. We want to see like how would that play out if we were to kind of activate that dimension amongst children who are suffering from bipolar disorder and severe depression, and how would that also heighten their emotional and spiritual wellness. So some preventative strategies here. So antipsychotics and mood stabilizers have been used for children as young as 2 years old to prevent the symptoms that occur from bipolar disorder, but not necessarily prevent the disorder itself. However, Navsaria and her team in 2010 ran a study, and they found that although it's sort of lacking some knowledge, endophenotypes, which are those traits that kind of signal the potential of bipolar disorder, if they can find those prior to onset, then they may be able to suppress that trait from activating to keep them from experiencing the bipolar disorder. As for depression, you have Tracy and all, they did a study where they contributed or looked at the trigger factors or understood what sets off an individual or a child from feeling, or what keeps her from feeling those symptoms of depression, such as sadness or fatigue or the suicidal thoughts. What about her environment makes her think about those things? And they found that if you can catch the triggers or you can control the triggers, you can control the disorder. Also, there are some people who use antidepressants to suppress the symptoms of the disorder, but again, it's not really preventing it. So, some preventive strategies when using exercise. So, physical wellness is the key here. So, there's been a study for bipolar disorder that was ran by Mihaela and her team, and they took a group of children, a few who were diagnosed with bipolar disorder and a few who weren't, and they just put them through some sort of exercise training, and like playing soccer or something like that. And what they found was that the children who were diagnosed with bipolar disorder, they actually had a reduction in some of their symptoms, but it didn't completely go away. It just kind of reduced it. So what happens if we use that prior to full onset of bipolar disorder? Also, we found another study by Martino where they did a exercise program, and this was for an older generation, the geriatric generation, and they found that it increased their lifespan, and it also heightened their physical well-being and made them feel great about themselves, reducing the symptoms of bipolar disorder. And they found that it also helps for children as well. So all ages can experience that. And I'm sorry, correction, that was for depression, that study. So the symptoms of depression can be reduced with physical exercise. So some of the optimal strategies here, just being aware of your disorder. Also understanding what your triggers are and being aware of how you can cope with your symptoms as far as depression or bipolar disorder. Physical activity and exercise, maybe just 30 minutes a day, doing something, whether it's running, swimming, playing a sport, just to kind of keep your physicality optimal. Adherence, not just starting, but sticking to your plans and sticking through researching. Sticking to researching your the new studies that come out regarding the disorder that you may be or your child may be associated with, and just support. Understanding that support is necessary to endure anything, really. So, with that said, motivational theory that I chose was attribution. And there's these 3 questions here that I pose based on the book from the class. So where does the factors come from? Who controls the factor? And is this long-term or intermittent? And that means whether you're succeeding or you may be failing at whatever it is, whether it's sport-related, academic-related, your relationship, marriage with your children, you want to look at what's causing. Is it an internal factor or an external factor that's causing this success or failure? You also want to understand who controls the success or other factor, who controls the success or failure. Also, does the success last or the failure last, or is it just momentarily? So those are some of the things that you wanted to, as a parent or as a child who is capable to understand the methods, we want to look at. So some barriers for using exercise amongst the children 2 through 17. Obviously, they're all different sizes. Their bone growth is at different rates, different states. So genetically as well, are you working out outside? Is sun exposure going to be a detriment to the child? Are you working inside? Are they allergic to anything that you may be using, or there's latex part of the physical activity or the exercise? So those things come into play. As some children are not capable to speak up for that type of thing or those substances. Cognitive ability, so their learning mechanisms. Everybody isn't a hands-on or a visual learner or a learner verbally. So how can you interpret the workout prescription for them? Adherence. Parents and guardians must be involved for children who cannot drive themselves or who do not have a license. So they cannot adhere to the exercise prescription. How are the children supposed to adhere to it? Also, age range. It's the main barrier because all of these play a factor in just age of the child. So here's a quote I found from the Bible from 1 Peter 2 and 9 that says, "You are a chosen people, a royal priesthood, a holy nation, God's special possession, that you may declare the praises of him who called you out of darkness into his world, or wonderful light." So God doesn't want anything bad for us. He doesn't want us to be in a state of darkness where we're feeling depressed and feeling we have no purpose. We're feeling like we're fatigued or isolated from the world and from his creation. If we are his chosen people and we are a royal priesthood of his, he would want us to live as such. So we need to, as a community in the science world, we need to continue to investigate and research some of the optimal measures of how we can help children. They're so young, they're so innocent, they're so vulnerable, and to think that we're feeding them medication all the time, there has to be a better way. Some of these medications have been around since the 60s, 50s. So it's tough for us to just continue feeding them, medication without finding some other way and where they can see the light of God. So the takeaway is that with education, family support or supportive friends, structures around you, the exercise, fitness abilities, feeling that you have a purpose or understanding what your purpose is, whether it's in school or just in life general, will help us to push children out in the world without these disorders or without these symptoms so that they can be great adults and teach the next upcoming generation without having to cope with their own mental disorders. So these are my references, and I hope I was able to teach someone something, and thank you for a wonderful semester, Professor, even though I didn't have the opportunity to meet you or either of my classmates. Have a great night. Bye.